All this is Dr. Mobeen Sayed from drbean.com. Welcome to one more show. So today we're going to talk about a topic that has been on my radar, but I have been very hesitant to talk about it, and that is children and COVID-19. However, considering that the cases in, for example, Brazil are increasing and the cases in India are increasing, it is important for parents and doctors to know what are the symptoms. And when I say doctors, of course, pediatricians would know much more than I do, but I'm talking about the doctors who generally look at patients or who are in emergency rooms and may not have enough COVID experience with the children. And I would cite a story here as well of a child who was presented to a doctor who thought the child was okay and the symptoms were not related to COVID, and then the child died. So let's start our discussion. I want to keep this video small so that it can be shared or it can be saved somewhere so that you can. And I also tried that the symptoms are on one page so that with least amount of traversal of the video, you can see the symptoms. So let us start. So this is drbean.com. Here are the articles and studies and various other pieces of information that I've used. This is a BBC report on Brazil. This is BBC Brazil. This is a child that unfortunately passed away because the child's symptoms could not be detected in time, and then child could not be managed in time. And I have summarized the history of the child and the progress of the disease. I would talk about that as well at the end of this article. So I don't want to read the article. There is a link in the description. But at the end of the article, there is an important thing, and that is the Royal College of Pediatrics and Child Health and their indication for when a child should go to hospital. So that is one. Here is COVID-19 in children, CDC. Again, not too useful, but they are a part of our life. So this is that information. This is also CDC for pediatricians. Not very helpful. This is Mayo Clinic and their symptom set. This is John Hopkins and their symptom set. Then this is the American Pediatric Association or American Academy of Pediatrics and their assessment of the children and their infections. Then I have a couple of, there is a study here as well from UK where they have talked about the new variants and the infection rate in children and mortality rate in children, and if there is any difference that they've seen. So we'll go over that as well. And finally, there is one tiny thing. This is actually one of our competitors, you can say. So I don't want to use their work, but I just want to use a small 10-second clip. I hope they would be okay with this. So with this, let's start. So this is our gifts of humanity continuing, and here is what we have. And I have deliberately tried to keep everything as close to one page as possible so that we can keep this information concise. So first of all, starting here with John Hopkins. John Hopkins says that a child should be brought to emergency or 911 should be called when they are unable to keep down liquids. So that is when they drink liquids or milk, they vomit it. They have difficulty in breathing, new confusion, inability to awaken. So the child was all right and alert and fine, and then they have become confused, or they do not respond. They are not waking up, or they're becoming cyanosed or bluish, which is a sign of less oxygen. And normally it starts from the lips. We call this central cyanosis. And what happens is that the tongue and the lips and sometimes the eyes areas, those start becoming blue first, and then the rest of the body. So this is John Hopkins criteria to say, if you see any of these, please call 911. BBC, the article that I just showed you, they have here, this is the list that I'm going to be presenting here. This is the Royal College of Pediatrics and Child Health. They say when the child becomes pale, mottled, cold to touch, or extraordinarily or differently cold, more cold. And what do we mean by pale? Pale is because their blood circulation is not appropriate. Mottled is that when the skin doesn't have enough hydration and it would become all wrinkly. And for a child to have a wrinkly skin is not the right thing. And then they become cold to touch. So they because of the lack of circulation or less circulation and less energy in the child, they start becoming cold. Pauses in breathing, that is called apnea. So in apnea, what would happen is that child would take a breath, and then for 15-20 seconds there will be no breath. That is apnea. Apnea is no breath. A stands for nothing. Apnea, no breath. So there is apnea, breathing is stopped, or there is irregular breathing, and there is grunting. And this is what I wanted us to know. And mothers usually know these things. So it is me trying to present something that they already know. But there are young mothers as well, or there may be family members around that are not aware of. So I think it is an important thing. So I hope my mic can pick up this. Otherwise, this is a video. You can just YouTube it and say grunting, and you can hear that sound.
Grunting may sound like snoring or singing.
So that is the sound of a child grunting. So if the grunting sound is made, that means child is having difficulty breathing. Then difficulty in breathing, agitated and unresponsive. Agitated is that they are irritated, the child is irritated. Blue around the lips, same thing again, cyanosis. So these are all the factors that if you observe in your child, any child, 911 should be called, or they should be brought to emergency. And I hope it does not happen to anyone. Fit or seizures. And the reason for fits or seizures is that once the oxygen levels have dropped and the oxygen is not available, that is when in the early parts of ischemia in the brain, child can start, and even adults, they can start having fits or seizures. Rash that does not disappear when pressured. So very often doctors, what they do is that if there is a rash, you press on it. If you press on it and it becomes pale, so if you can look at my hand, or let me do this, look at my hand's color. And when I make a fist and then I leave it, you would see that the hand would become pale. So what happened was that blood was moved out of the hand out of pressure. And when I left my hand, the blood would come back in. You can do that with your hand as well. So the same thing is with the child as well, that if they have a rash, which is just more redness there because of some extra circulation in that area, because of maybe there is an infection or some injury, then when you press on it and you leave it, what you would see is that the rash will become pale, and then it would come back in a few seconds. But if there is a bleeding under the skin, then that may look like a rash as well. But when you press on it, that blood will not go anywhere because it has bled under the skin. And so it won't go anywhere, and the rash will not go away. It would stay. So this is the rash when applying pressure, and that does not go away. I would add one more here, and I think the reason is that they are probably they have not put it here because they think it may not be at home. That is the COVID toes. Bluish color or reddish color or discoloration of the toes or fingers, fingertips, nose tip, or toes, many times toes, could also be a very important indication of a child suffering from COVID. So COVID toes, I would add to this over here. Extreme distress, crying, confused, lethargic. Continue to cry and you're trying to distract the child, or you do whatever regular things you do to stop them from crying, and they still are not stopping. And they're confused and they're lethargic. These are also signs of COVID. Testicular pain in teens. So all of these signs, if they appear, one must go to emergency or urgent care. So with this, now the child from Brazil, that article I showed you, the child's name is Lucas, and he was 9 years old and he died. Now, generally, the children 0 to 9 years of age and born to 9 years of age, the death rate from COVID is 0.58% of the cases. So it's not a very high death rate. Still, in Brazil, in this age range, there have been 2,000 children died so far. So that is a trauma that would stay with parents forever. And that, I don't think that there is anyone who can understand what happens. We can observe, but we cannot understand it. So what happens to Lucas? What happened? His mother says that he developed diarrhea. So the symptom to start with in children was diarrhea, and this is something that is very important to note. So we looked at what is clinically important for urgent care. Now for general signs, this is very, very important. So the doctor who are managing children, they're saying a child has a lot more diarrhea, a lot more abdominal pain and chest pain than the classic COVID picture. So a parent who is thinking that maybe when the child would have cough or runny nose, that may not be the first signs. The first sign may be diarrhea and abdominal issues. And the reason for that is that when child has swallowed the virus, this virus can cause gastroenteritis because it has a lipid membrane on it, and it can escape the acids from the stomach. So it would go in the stomach. In the stomach, it would escape the acids because it has a very good covering on top of it. It would end up in the intestine, and now it can cause gastroenteritis. It can inflame the stomach and inflame the intestine. That would cause diarrhea, nausea, vomiting, and loss of appetite. I think mothers know that very first thing, a very early sign of a child's health problem is when they lose their appetite. So here, this is important to realize. Lucas started with diarrhea, then abdominal pain. So this is all the sign of gastroenteritis from COVID instead of the upper respiratory tract infection or respiratory tract, lower respiratory tract. Chest pain, comorbidities. So this child did not have any comorbidity. Then another thing that to keep in mind is socioeconomic status as well. Sometimes impoverished children are nutritionally deficient as well, and their immune systems are not working very well. Plus, when they get COVID, they cannot handle the COVID side effects very well. So Luca lost appetite, fever and fatigue came after that, labored breathing came after that. They took him to a hospital. The doctor did an oximeter reading. The oxygen came back to be 86. Doctor said the child does not have any signs of upper respiratory tract infection, nasal congestion, so it probably is something else, and they gave them antibiotics, probably for pneumonia, and sent them home. They said, the parents said we should do COVID test. They said no, there are no signs and symptoms of COVID, and sent them home. And the child stayed on those antibiotics for 10 days. At the end of the 10 days, the mother says that the child did not improve, and his difficulty in breathing and those other issues stayed. He became more lethargic and more tired. And one important thing that, again, mothers, I always say that mothers are the best doctor for their children. They just know if there is anything wrong with the child. The child started becoming sleepier and sleepier. So mother says, I could observe that he's sleeping more. And then it became an issue. They ran back to the hospital. They could not bring him to a local hospital. They had to go for a hospital that was 2 hours away. Over there, when they started looking at the child once more, they felt that he was not doing well. They admitted him. Eventually, he became, unfortunately, intubated. Then a few days later, so he stayed in ICU for 30 days and then died. So a few days later, he had cardiac arrest. Then he improved. They even started talking about removing him from the ventilator. And then he developed a stroke, and then he died. This part is very similar to the adult, my friend's brother who was in New York on ventilator, he was on ventilator for 3 months or more. And his last days were also very similar, that he actually started improving. He came back to consciousness. He was not coming back from coma. He came back to consciousness. I have his videos where he was feeling warm and he had something in his hand, and he was doing this to his self to kind of cool himself down. And they were thinking of taking him off of the ventilator. He had a endotracheal tracheostomy. So they were thinking of all of those things, and then one day they simply said that he had a cardiac arrest and he died. So here a similar thing happened to this child and he died. So the important thing from mother, she says that now I keep telling others that symptoms don't have to be nasal congestion and runny nose or cough, or even fever. It could be diarrhea, and that could be a sign. It could be then fever and other things. So after this, CDC, what does CDC say? So if we go here to CDC, actually here is CDC. CDC says in no particular order: fever, 104 or more, chills, nasal congestion, runny nose. Runny nose, they do say runny nose. Sometimes we say that runny nose is not part of COVID. But runny nose nowadays is part of COVID. CDC a couple of months ago had updated their symptom list to say runny nose is now part of COVID. So, or one symptoms of sign and symptom: loss of taste or smell, sore throat, shortness of breath, diarrhea, nausea, vomiting, stomach ache, tiredness, headache, muscles or body aches, poor appetite, poor feeding, especially in smaller children. This is CDC. In my opinion, one lazy part of their work, once again, is not to prioritize it, or not to say that, hey, sometimes the patient might just have diarrhea, or they must just have the rash, skin rash. They have no such thing. Here are the things, and good luck. I'm not a, you can tell I'm not a fan of CDC. So here is another set of CDC symptoms which they have for pediatricians. And once again, they just copy pasted the same list over here. Then this is the Mayo Clinic, and Mayo Clinic actually copy pasted what CDC had. And honestly, we cannot fault them for this. They cannot invent new signs and symptoms to put here. This is what they see. So fever, chills, nausea, nasal congestion, difficulty breathing, shortness of breath, fatigue, headache, muscle and body aches, nausea, vomiting, diarrhea, poor feeding, poor appetite, loss of taste or smell, and belly pain. They said stomach pain or abdominal pain, they said belly pain. And then finally, John Hopkins. So this is the John Hopkins, Hopkins medicine for children. And here, fever, chills, congestion, runny nose, shortness of breath, fatigue. They do not have headache or some other things, muscle and body aches, nausea, vomiting, diarrhea. They also do not have poor feeding. They do not have headache, loss of taste or smell, and cough. So that is what they have. Cough, interestingly, is not here as part of Mayo Clinic. And I did not see cough here with the CDC as well, which is strange. But anyways, they must know something, or they must not know something. So then here, some stats from American Academy of Pediatricians. So this is American Academy of Pediatrics. And here they have some data which I think is interesting for us to keep in mind. So the stats are that out of all the COVID-19 cases, 13.5% are children. That's a significant number. However, the good news is hospitalization and mortality rate is very low. So children can handle this infection much better than adults. So 13.5% are children. 0.1 to 1.9 of these 13.5% can be hospitalized. And then 0 to 0.3%, 0.03% is the mortality of the cases. So this is low, and this is actually a good news, but still it is, of course, we're talking about children. Now, finally, the thing that I want to show you is this. This is a study from UK, and the link is here. I have that link in the description as well. Effect of the new SARS-CoV-2 variant. So this is a study done in UK. They wanted to understand that the new variant, is it causing more infections, or infection rate has increased in children or youngsters, and the death rate has increased in children or youngsters. So that's what they wanted to understand. That is what they have done here. Their basic conclusion is no, there is nothing like that. They did see, so there is a table here that you can look at, and here is the table, just to give you a summary. Wave 1, March 1 to May 31, 2020. Number of patients who were children, 20. Wave 2, November 1 to January 19. The number of children who were patients was 60. However, this is an important part because they actually talk about it that media just pick up these numbers and start saying there is something wrong happening. Of course, there is something wrong that we have instead of 20, we have 60. We don't even want one child. But in comparison to the previous wave, there was a 3 time increase in adult infections as well. So it was a generally larger prevalence of infection instead of an attack on children more than the adults. So if you see here, these early second wave data show that many children and young people have been admitted to hospital. This might be due to the higher prevalence of SARS-CoV-2 within a local community. And check this out. Indeed, the number of adult patients admitted to King's College Hospital in the second wave has also increased by about a third. So there is an increase there as well. Importantly, we have found no evidence of more severe disease having occurred in children and young people during the second wave, suggesting that infection with the B117 variant does not result in an appreciably different clinical course to the original strain. So this is the discussion. The reason that I wanted to put this together is that folks can keep this video around, and if for a child they can just maybe take a screenshot of these or look at those uh, links and then maybe write down for your own self that here are the things to keep in mind, and maybe we can help others as well who have children. So thank you very much. Please like, subscribe, and share. If you would like to support this work, there are 3 links in the description. One is if you wanted to avoid PayPal, there is a link to buy me coffees. There is another link to become a patron, and one link to support this work in general. Thank you very much, and I would see you in a few minutes for chit chat.